Yeah, it looks pretty good actually.
So you just relax the best you can.
It's swollen, but
Yeah. So we still want to work on that extension a little bit. It's not totally straight. We'll compare it to the other one. Have you been doing any of the cupping?
I've been doing this.
Yeah, so the scar mobilization's great. Let's do some cupping. Stay
Let's
right there. I'll show you. So all it is, you squeeze it, you put it on, and it creates a little vacuum. I might put some lotion on there.
Won't be 99 anymore.
Okay, so I'm gonna spread that lotion around just a little bit. Yeah, we got it. Yeah. Is
I
that
felt that.
so? What it does, it creates a little handle so I can lift the skin,
And move it
separate
around.
the superficial layer from the deep layer. You can go all the way down the length of the incision. I'm gonna have you do it. How long ago was surgery?
December 27th, so 6 weeks.
Okay.
6 weeks. Okay, now what?
Move it around. You can
Do I have
release
to?
it.
I do?
Yeah.
Okay.
Yep, and then let it go. There you go. Let's spend like 2 minutes.
Doing
You
that?
can, yeah, you can also go on the sides
Okay.
just a little bit. So release it, kind of bring it off on the side. There you go.
And then that helps with the...
Yeah, it'll loosen up that incision.
That works.
Yeah. So what we'll do is we'll do the incision for about 1.5 minutes, 2 minutes. Then we'll come down into this inside knee. This is the Pezanserine area.
Yeah.
And we'll do a little work in there. Because that always becomes sensitive too.
It is. It hurt. Whoops. Okay.
Start to come down into the inside of that lower knee. Any of those sensitive areas.
That is sensitive down in there.
Yeah.
Oh, yeah. And why is that? Just because of all the trauma of doing it?
It's usually a couple of things. The knee was probably either it bowed out, which is more common. Sometimes it bows in. They do a knee replacement. You have a perfectly straight knee now. And what happens is you get new pressure in those areas.
And it's not used to it.
Yeah. The other part is you have multiple tendons, muscles that come through and cross over that area. They attach into the bone. They're pulling on it. That becomes sensitive. So we'll just do about 1 minute. This increases blood flow. It desensitizes those sensitive areas. And then when we exercise it, it doesn't hurt as much.
Who does that? He's running the check now. Here's a build up.